Hello, welcome to Healthy Eyes Hub. In today's episode, we will talk about the conjunctiva of the eye. Comment below with positive feedback and subscribe to this channel to learn more about our eyes. Let's dive in. The conjunctiva of the eye lines the inner parts of the eyelids and gives covering to the sclera. It meets with the cornea at the limbus. It protects and lubricates the eye by the protection of the mucous layer of the tear film. It is highly vascularized and has a lot of lymphatic vessels. This way, it is able to protect the eye from microorganisms through immune surveillance. Immune surveillance is the monitoring process by which cells of the immune system detect and destroy pre-malignant or malignant cells in the body. The conjunctiva, therefore, can detect and destroy bad cells trying to invade the eyes. It is non-keratinized, which means it is not able to change into a form containing keratin. Keratin is needed for forming outer body structures like nails, hair, horn, feathers, claws, and so on. In addition, the conjunctiva is divided into three regions depending on which part of the eye it gives covering to. These are tarsal or palpebral conjunctiva, bulbar or ocular conjunctiva, and conjunctival fornices. The tarsal or palpebral conjunctiva lines the eyelids. It is further divided into three areas signifying which part of the eyelids they line. These are the marginal, tarsal, and orbital areas. The orbital or ocular conjunctiva covers the eyeball over the sclera anteriorly. The conjunctiva is tightly bound to the underlying sclera by Tennant's capsule and moves with the eyeball movements. The space between the sclera and the Tennant's capsule is a good area for local anesthesia during most eye surgeries. This way of numbing the eyeball is referred to as subtenon block. Finally, the conjunctival fornices forms the junction between the bulbar and palpebral conjunctiva. This region of protective covering is flexible and loose, unlike the bulbar conjunctiva. Therefore, it allows for globe and eyelid movements. It is also the pouch in which eye drops, gels, and ointments are instilled. The conjunctiva has the greatest number of goblet cells in the area closest to the fornix. Goblet cells are unicellular mucous glands that are most common in the inferior and medial conjunctiva, as well as near the medial canthus. The number of goblet cells decreases further away from the fornix. These cells produce mucus to form the inner mucous layer of the tear film. The mucous layer helps to glue tears onto the cornea for lubrication and clarity of vision. Let's look at some common problems of the conjunctiva. The conjunctiva of the eye is exposed to many external hazards that may injure or damage it. The two most common problems affecting the conjunctiva are pink eye, that is conjunctivitis, and subconjunctival hemorrhages. First, pink eye is a common eye infection. It may be caused by allergens, irritants, bacteria, or viruses. Treatment options will depend on the cause of the irritation in your conjunctiva. Second, subconjunctival hemorrhages is the medical term for a broken blood vessel on the surface of your eye. Blood then leaks from the broken blood vessel beneath the conjunctival spaces. The red spots caused by the conjunctival hemorrhage can look scary, but most cases do not result in symptoms or need treatment. Other common disorders of the conjunctiva include dryness, chemical irritation, and trauma. All of these disorders cause the conjunctiva to be inflamed. Conjunctivitis refers to inflammation of the conjunctiva. Hence, to differentiate which type of conjunctivitis one has, the eye specialist may qualify it with the cause preceding it, such as allergic conjunctivitis, bacterial conjunctivitis, or even chemical conjunctivitis, among others. Clinically, the trained eye specialist can assess the conjunctiva using common stains at the slit lamp. A small amount of fluorescein dye is applied to the ocular surface. Then a light source with a blue filter is used to detect areas of increased stain uptake. These areas of increased dye uptake are indicative of damaged epithelium. Also, lissamine green and rose bengal can be used to stain the ocular surface with appropriate absorption filters. Although both lissamine green and rose bengal have similar staining characteristics, lissamine green is better tolerated by patients and hence is more frequently used in the clinical setting. The There are various topical eye drops, gels, and ointment that can be prescribed to manage these problems. Your eye specialist would be able to advise you and recommend treatment regimen accordingly. It's been nice learning with you. Kindly subscribe to this channel and leave a helpful comment below. Thank you.